Welcome to Pharmacology lectures. Now, as we have finished the kinetics chapter, we'll have a look at some case studies. Now, first case study is an 18-year-old female patient is brought to the emergency department due to drug overdose. Drug overdose. Now, which of the following routes of administration is most desirable? Here we need antidote plasma levels rapidly, so the rapid route of administration is only one, that is IV. Next, drug A is weekly basic drug with pKa of 7.8. If administered orally, which of the following sites of absorption will the drug be able to readily pass through the membranes? Now, because the drug A is weakly basic, it will predominantly be in the non-ionized form in the jejunum, which has pH of 8. For weak bases, the non-ionized form will permeate through the cell membrane rapidly. So this is the correct answer. Now, KR2250 is an investigational drug, cholesterol lowering agent. It has high molecular weight and is extensively bound to albumin. So this will have dash apparent volume of distribution. Because of its high molecular weight and highly protein bound, it will be effectively trapped within the plasma compartment and will have low volume of distribution. A 40-year-old male patient, 70 kg weight, was recently diagnosed with an infection involving methicillin-resistant SREs. He received 2000 mg of vancomycin as an IV loading dose. The peak plasma concentration of vancomycin is 28.5. What is the apparent volume of distribution? We know the formula of volume of distribution is equal to Vd dose divided by C, concentration. Now, dose is 2000 divided by concentration is 28.5, and it equals 70.1 liter. Now, because the patient is 70 kg, so the volume of distribution per kg will be 1 liter per kg, and the correct option will be A. A 55-year-old woman is brought to the emergency department because of seizures. She has a history of renal disease. Currently undergoes dialysis. She receives an IV infusion of anti-seizure drug. Which of the following is likely to be observed with the drug X? What will happen to half-life? What will happen to dose? Since the patient is of renal disease, it means the drug will not be cleared. So the half-life will be prolonged. It can be A, C or D. Now, the drug half-life will be prolonged. As the half-life is prolonged, the dosage must be reduced so that the patient will not have any toxic effects of the drug X. So we will consider the option D. Now, a 68-year-old woman is brought to the emergency department for the treatment of MI, myocardial infarction. She is currently taking clopidogrel, which is an antiplatelet agent, aspirin, as well as omeprazole, which is a potent CYP inhibitor. Okay, which of the following is the most likely contributor to her MI today? Reduced antiplatelet activity of clopidogrel due to aspirin. As you know, omeprazole is potent CYP inhibitor. Clopidogrel is a prodrug. Okay, it requires enzymes to become in its active form. Now, because we are taking an inhibitor, it means there will be no enzyme to make it in its active form, and thus its antiplatelet activity will be reduced and it will contribute to MI. So the option B is correct, reduced antiplatelet activity due to omeprazole, which is a potent CYP inhibitor. Next, which of the following reaction represents phase 2 of drug metabolism? Amidation, amine, addition of amide group, hydrolysis, oxidation, reduction, or sulfation. Now we know phase 2 metabolic reactions involve conjugation reactions to make phase 1 metabolites more polar, to make it eliminate. Now sulfation and glucuronidation are the most common phase 2 conjugation reaction. So here the option E is correct. Next, a pharmacokinetic study of new antihypertensive drug is being conducted in healthy volunteers. Antihypertensive drug. Half-life of the drug after administration by IV infusion is 12 hours. This is the half-life. Which of the following is the best approximate the time for the drug to reach steady state? Now we know steady state concentration is achieved after 4 or you may say 5 half-lives. So we will consider 4 half-lives. 4 into 12, which is equal to 12 is the half-life of the drug known. It will be 48 hours. So after 48 hours the drug will reach its steady state concentration. Option B is correct. A 64-year-old female 60 kg weight is treated with experimental drug A for type 2 diabetes. Drug A is available as tablets with oral bioavailability of 90%. VD volume distribution is 2 liter per kg and the desired steady state plasma concentration is 3 milligram per liter. Which of the following is the most appropriate oral loading dose? Now as we all know, loading dose is equal to volume of distribution into CSS steady state plasma concentration divided by F bioavailability. Loading dose we are going to calculate. Volume of distribution is given, which is 2 liter per kg. Steady state plasma concentration is 3 divided by F. 90% means 0.9, and this when you multiply 2 3 is 6 divided by 0.9 with 2 is 2 liter per kg, and we know the patient is of 60 kg, so it will be 120. Sorry, 2 into 60, because this is per kg, we need for 60 kg for this patient, so it will become 120 into 3 divided by 0.9, and so the answer will be 400 mg. Answer option E. Okay, next. A 74-year-old man was admitted to hospital for the treatment of heart failure. He received 160 microgram of digoxin IV and the plasma digoxin level was 0.4 nanogram per ml. If the desired plasma concentration of the digoxin for optimal therapeutic activity in heart failure is 1.2 nanogram per ml and the patient has an estimated volume of distribution of 400 liters, we have to calculate the additional dose of digoxin which is needed for this patient to achieve the desired plasma concentration. Now you can see we need to calculate the desired dose. We have the formula, that is desired plasma concentration dose is achieved by VD and C2, which is the desired plasma concentration, and minus C1, which is this one, that is the plasma digoxin level was initial. Now VD we know it is 400 liters, C2 is 1.2 minus 0.4 C1 initial, and the answer when you calculate is through calculator, it will be 320 mcg. Option C is the correct one. You have to always remember the formulas. These will be very helpful even in your clinical settings or if you go for any licensing exams. Thank you.